Okay, Michelle. Tell us a little bit about your experience with this office and me, Dr. Okereke, and with Body Logic in general.
Okay. My name is Michelle. I am 56 years old as of December this year. I've been a patient with Body Logic since 2010. I've been a patient of Dr. Phyllis Okereke since January 2015. I have had nothing but really good results with the company, the products, the services with Dr. Okereke especially. I think I've done even better since I've been a patient of hers specifically. I am completely convinced that Body Logic and my bioidentical program has allowed me a more active lifestyle. It has given me a higher quality of life. And I just think in general, I'm able to enjoy my postmenopausal years so much better because of the program and specifically because of Dr. Okereke.
Okay. So what's the biggest difference that you noticed between where you were before and where you are now?
Prior to starting the program, I noticed that no matter what time of the day, no matter whether it was early morning or evening, I always appeared to look tired. I didn't have as much energy, and at the time I didn't know I didn't have as much energy. I just didn't feel as active. I was having trouble sleeping. It seemed like I would stay creaky longer in the daytime after waking up in the morning. And it seemed like no matter how much exercise and I could push myself to do, I would either not lose weight or I would continue to gain weight, specifically around the middle area, my belly and thighs. Since I've started the program and most recently within the past couple years, I've actually seen a lot more, I've seen my exercise program being a lot more effective. I do pay more attention to what I eat, and under the direction of Dr. Okereke, I've followed her recommendations to drink more water, to take the supplements that are recommended. And I think that in conjunction with my hormone replacement and supplements, I think that has allowed my body to adapt to the changes that I'm looking for. I'm able to exercise 4 days a week. I do a combination of yoga, Zumba. I do cycle class, which is very intense, a very intense cardiovascular workout for 60 minutes. I do strength training, and I rotate at least 4 times a week. And I've seen a reduction in the inches. I've definitely seen a reduction in the belly fat. And I've also found that I sleep better. My sleep is more productive and sound. I wake up more rested, and I definitely think I appear to be more refreshed.
Good. And how easy or hard was the whole process since the beginning to now? What were some of the...
I'm sorry, say that again, Doc. I didn't understand that.
Said how easy or hard or difficult was the whole process? You know, the whole process you're going through since the beginning to now, and what were some of the major turning points or milestones where you noticed progress?
I think with any program, any regime you're starting, just getting into the routine, making yourself stick to things the way they're prescribed. And I think since I've been under Dr. Okereke's instruction, I find it easier to talk with her about the issues that I may have with locations of applying the creams. And I've gotten a lot of tips from her as to where to apply them to make them more effective. And once you find the secret, it makes sticking to the regime that much easier, which then allows the program to actually work more effectively. And I think that's one of the benefits, the biggest benefits that I found since working with her personally, is that she's very sharp as far as asking the right questions to get the best results, to get the best answers. And that, I think, is what I found the biggest difference is she's easier to talk to and to identify with. And her instructions are very personal and specific, and they make the program that much more effective. It's worked better for me.
And is this a type of program you would recommend to another person, be it a friend, family member, or even a co-worker?
I highly recommend it. I highly recommend it to my coworkers. Most of my friends are around the same age. We're in our early to mid-50s, and women tend to go through cyclical things that are similar. And so when I get a comment that I think, or a compliment that's specific to the way I look or to the type of activities I'm able to do, I share with them the fact that I was able to do these things. I'm able to be this way because I picked up this program and I'm working with this particular doctor in this particular company. And I believe that that's been 90% of the success that I'm seeing. So I definitely recommend it when I can, as often as I can.
I know, Michelle, that you're a registered nurse, so you are really involved in healthcare, and you know what taking care of patients means in the conventional medical setup. Please, could you explain some of the differences you've noticed between your conventional medicine experience and what the way I practice in my, or the way I've taken care of you?
Being in healthcare, I've been a nurse for about 20 years plus, and I definitely see how I've seen the changes in the body, and I've seen things that I think people have been able to would be able to change if they had the proper instruction and information. And the difference that I've noticed between my regular doctor and Dr. Okereke is that she's a specialist. And as a nurse in a specialty area, I know that whenever you are involved in a specialty, you are the most knowledgeable about that area. And the differences that I've found with my internal medicine doctor and Dr. Okereke is when I have issues that relate to how I feel and how I want to feel, I can give her that information and she can tailor specific the hormone regime and the supplement regime to meet those needs. And since giving her the opportunity to do that, like I said before, I've seen tremendous strides towards the goals, the personal goals that I have for health and fitness and vitality and beauty and anti-aging. So I believe as an anti-aging specialist, she has been highly instrumental in meeting those goals.
Thank you very much, Ms. Wiley, Michelle. And I appreciate you're doing this because it will help other patients or other people who are considering and wondering what to do next. So thank you for helping us keep the population healthier. Thank you very much.
I appreciate it. Thank you, Dr. Okereke. I appreciate everything that you've done, and I appreciate the fact that you'll be able to do this for the next 100 years, and that way we both can continue to help each other.
Great. Thank you.
The way we have.
Okay, have a
You're
wonderful
truly a
day.
blessing. You're truly a blessing. It's a testimonial, but it's based on fact, and she's a very nice person as well. It's one of the most comfortable professional relationships I've had with a medical professional, you know, in a really long time. So I really appreciate you giving me the opportunity to verbalize how I feel about this program. And I just hope that you continue to provide me with the information that you've given me up until this point. Your office staff is very friendly, very helpful, it's very efficient. And all those things are important because this is a time-conscious society, and I'm just as busy as you are. And so I appreciate you valuing my time as much as I value yours. So I appreciate it.
Thank you, my dear. Have a wonderful year.